This is part 4 of chapter 2. On example 2.6, we are going to be pulling information off of a drug label. Okay, so the first thing we're asked to find is the trade name. The trade name is capitalized, so we have that. The generic name is usually in parentheses right beside it in lowercase. Okay. And then what form is the drug in? So I start looking through here and I see tablets. So that's what we're looking for. These are tablets. The dosage strength. Each of these is 2.5 milligrams. Okay. And then we're asked for the NDC number. That is the National Drug Code number. And that is right up here. So I'm going to put 0069-1520-66. Okay. Dosage and use. So I start looking at this. It says dosage and use right here, but it says to see accompanying prescribing information. Okay, and then instructions for dispensing. Okay, so we start looking for restrictions. Sometimes they tell you what kind of bottle it has to be, and sometimes they tell you it has to be refrigerated. Sometimes they tell you other things. What we are being told here is that it has to be in a controlled temperature, and we're supposed to dispense in a tight, light-resistant container. Okay. Okay, and that's what we need out of that. Okay, so for the next example, we are given this drug label. And again, we are going to be answering questions based on this label. It's usually not very difficult. Okay, so let's see what we're asked to find. We are asked first to find the trade name. Trade name is capital letters, Norvir. So, Norvir. The generic name is right here. So, Ritonavir. Okay. Now, what form is this in? It is an oral solution. The dosage strength is 80 milligrams per milliliter. Okay. And the amount of drug in the container, it has 240 milliliters in it. The storage temperature, it just says do not refrigerate. Okay, and then special instructions. This is where you look for things like here. Find out about medications that should not be taken with Norvir. So that's what you're looking for here. And you get the idea. You don't need to see me write down absolutely everything that you can read and copy over for yourself. Okay? All right, so next one. Very similar. We have a drug label, and we're asked to pull information off of it. Okay, so again, we want the trade name, Levothyroid. Okay, the generic is here. Okay. The form, we're told it's tablets right there. Okay. The dosage strength, it is a 25 micrograms. Okay. And the usual adult dosage. So I start looking at this and turning it. Usually it will have something telling you basically what it is, but this says see full prescribing information. So we can't read that off of the full label. Okay. Okay. Now we have a label for Vicodin, and we're going to be asked to find the same basic information off of this. Our first question is the trade name and dosage strength. Okay. The trade name is Vicodin. And the dosage strength, it is, this is a combination drug. Okay, so it has hydrocodone and it has acetaminophen in it. So what we say here is this is a 5 milligram per 500 milligram per tablet. So we're giving 5 milligrams of hydrocodone and 500 milligrams of acetaminophen within this one tablet. Okay. What is the dosage strength of acetaminophen? So right here, the acetaminophen is 500 milligrams. Okay. What is the route of administration? Well, these are tablets, so we take them by mouth. What is the amount of the drug in the container? The container has 100 tablets. And then what is the usual dosage? Usual adult dosage, see package insert. Sometimes they really do tell you things, I promise. Okay, now for question 210, we're supposed to read excerpts of the package insert, and that's provided to us on the next page, and fill in the requested information. Okay, so let's see what we have here. We have this giant sheet with a whole bunch of information in it that's really small print. And the next page we have even more. Okay, now we get down to the questions. What is the generic name of the drug? So I'm going to come back over here. Okay, and let's see. Zyprexa is the trade name, and here is the generic right here. Olanzapine? I think that's right. Okay, so what goes right here? Olanzapine. For what condition is the intramuscular form of Zyprexa used? Okay, so I need to go through all of this and see right here it says dosage and administration. Okay, is that what I'm looking for? Intramuscular form. Oral. Intramuscular right here. Okay, so what I'm looking for here is this does treatment of acute agitation associated with schizophrenia and bipolar 1 mania. So basically, I'm going to write all of this over here. Well, over here. Okay, I kind of summarized that, but basically that's what it is. What may occur if the drug is taken with diazepam? Okay, so I'm going to look at drug interactions, and I highlighted this earlier, so I wouldn't have to look forever. With diazepam, let me see if I can zoom in a little bit. may potentiate orthostatic hypotension, sorry. So that's what I need to write here. Okay. What is the recommended beginning oral dose for adults with schizophrenia? Okay. The beginning oral dose in adults, the oral dose starts at 5 to 10 milligrams once daily. So right here, it's 5 to 10 milligrams once daily. Should women who are breastfeeding use this drug? Right here, nursing mothers, breastfeeding is not recommended. So, no. Okay, one more, and then we're done with this chapter. Okay. Read the drug information, answer the following questions. Okay, so this is betadine. And what is the trade name of the drug? The trade name is betadine. Okay. What is the active ingredient in this drug? Right here, povidone iodine. Povidone. Okay. Can this drug be taken by mouth? Well, it says, if swallowed, get medical help from Poison Control Center right away. So I'm going to say no. Okay. What danger may occur with prolonged exposure to this solution? Prolonged exposure to wet solution may cause irritation